In this video, I'm going to answer two of the most common questions we get asked with regards to jump rope and Achilles tendons. So the first one is, can jumping rope actually cause Achilles pain, and what to do if you think it has caused you pain? And second is, can you use a jump rope as part of your Achilles tendonitis rehab plan? For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. Have a look at the description of this video if you want a link to our website. Can jumping rope actually cause Achilles pain? Yes, it can. So when we jump or skip, the main muscles working are your calf muscles, and they attach via the Achilles tendon to your heel bone. So it's part of that springy action. So both the calf and the Achilles tendon works really hard. Now, you can irritate your Achilles tendon through two things. You can either do a session that's much harder than what you used to. So if you're new to skipping, it can just be that you start too quickly with too much. Or if you're used to jumping rope, then it can be that actually you've just done a session that's much harder than what you've done before. But it's also possible that perhaps you're just doing too many sessions in short succession. So you're not allowing enough recovery time. And the reason this can become problematic is that every time we exercise, our body accumulates micro damage. Now, don't think about micro damage as tears. It's actually just single cells that gets injured. And this is absolutely normal, and the body uses the micro damage to signal to it where it needs to strengthen you. So over time, it repairs the micro damage and then you grow stronger. But it can only do this if you allow it enough recovery time. So if you do another jump rope session before your Achilles tendon and calves are fully recovered, you end up accumulating the micro damage, and that can then cause overuse injuries like Achilles tendonitis or tendinopathy. What should you do if you have irritated your tendon by jumping rope? So the first thing is to make sure that it's not torn. A torn Achilles tendon will happen suddenly. So if you were jumping rope and you felt a sudden sharp pain, or like somebody kicked you in the Achilles tendon, or you heard a snap, anything like that, like a sudden incident, you have to suspect that you've torn your tendon and you need to see somebody immediately. If the pain developed gradually, so either gradually, slowly came on during the session, or actually the session felt fine and was only after you stopped jumping several hours later or the next morning that your Achilles was really painful, then it's more likely that you've given it a tendonitis or tendinopathy. And that will react really well to rehab. But you have to get it diagnosed first. So I've made a video before about how you can know if you've torn a tendon, so it may be useful to watch that. But the best thing to do is to consult a physio that they can diagnose this for you properly. Now, depending on there are two scenarios that will dictate how you treat your tendon when it has flared up like this and you've decided it's a tendinopathy or tendinitis. The first is, if you've never had problems with your Achilles tendon before, so it's not been painful before, it's the first time ever it's become painful, and it's only been painful or it started in the last 1 or 2 weeks, then you have what we call an acute flare-up. So it means the tendon is super painful and it's irritated, and there may even be a little bit of inflammation which is not present in the chronic or the ongoing ones. If you allow it to settle down, so you rest that tendon from all activities that loads it, it can often settle down without the need of any rehab afterwards, really. Because if it's that fresh and you don't have a history of tendon pain, you've not lost any strength in it. It's just a bit injured and niggled. And if you allow it to fully calm down over a few weeks and then ease back into your activities, that usually works absolutely fine. Now, it's important to understand 2 days of rest is not going to cut it. It's usually at least a week to 2 weeks to sometimes even 4 weeks that you've got to stay away from the really tendon loading sports. But you can walk and do things like that. And then when you go back, you have to ease into your activities. So you first want to get back to the ones that doesn't load the tendon that much. So it's things like fast walking. Once you can fast walk, you want to start loading the tendon a little bit more. So you may think about little jogs, or you could start adding in little bits of very gentle skipping, but short periods with rest in between. So 30 seconds on, 2 minutes rest, 30 seconds on, 2 minutes rest. But this is only if it's an acute flare-up and you've never had tendon problems before. If you've had a niggly tendon over several months or years, every now and again it flares up, but then it settles down and you can go on again, then you've likely got an ongoing tendinopathy. And that tendon of yours likely lacks a bit of strength, and it will have an area in the tendon where the cells aren't quite as they should be, where the structure of the tendon has changed. Now, if that's the case, then rest is not the answer, because if you're just going to rest it, the pain will go away, but nothing will change in the structure of the tendon. So as soon as you do your sport again and you just go a little bit too hard, it's going to flare up again. So if yours have been niggly before, or it has been going on for more than 1 or 2 weeks, you will have to follow a rehab plan. So your rehab plan will look more like you'll have relative rest, where you do take out the aggravating activities to allow it to calm down. But then you have to follow rehab exercises to rebuild the strength. So you'll start with really gentle things first and build the intensity of strength training over a long period, usually about 6 to 12 weeks. And then you get to add in plyometrics like jumping. And you can start using jump rope at that point. But there are certain things to keep in mind, and I'll talk about that in the next section. So to summarize this one, if your tendon has become painful because of jumping rope, 2 scenarios. First time ever it's painful, only happened in the last couple of weeks. You will likely be okay if you just rest it for a few weeks to let it fully calm down and then ease into activities. If you've had tendon pain before and it's been niggling on and off for several months, you will likely require a rehab program and then really careful plyometric training to make sure you don't get ongoing things, because your tendon will have some structural changes there. This leads very well onto the next section of, can you use a jump rope as part of your Achilles tendonitis rehab? Now the short answer is yes, but you have to be careful with how you introduce it. So if we look at what a typical rehab plan for Achilles tendonitis looks like, it's first got relative rest in there, so taking out the aggravating stuff, allowing it to calm down. Then you've got progressive strength training, so that means starting with very gentle exercises to introduce some load tolerance, but then you have to build that over several weeks to get to the point where it's strong enough to then accept the high loads of plyometrics, jumping and hopping. And it's important to also understand that it's not just about the weight you can push in your exercises, but it's also about for the number of weeks you do them for, because the body takes at least 6 weeks to start changing the structure in response to strength training, and then it takes another 6 to how many ever weeks, depending on where your starting point was, to really gain the strength you need. So it's not just about how quickly can I get to the right weight, it's also about for how many weeks you do it. So then at that point that you're ready, that you've got the base strength you need for your Achilles tendon, you then usually go through a plyometrics program. And then once you complete that, you get back to your full sport. Now I know you immediately think, plyometrics, that's jumping and hopping. I can do the jump rope there. But the problem with that is that when we introduce the plyometrics, it's usually a very tiny dose, so only about 60 hops spaced out over time with lots of rest in between to start with, and then you increase it very slowly, and it's all about the technique you use and really focusing on how you're doing it. If you're skipping or jumping rope, you've got the arms going on and you've got your focus is on not actually tripping up over the rope, so it's difficult to really concentrate on technique that well, and it's difficult to do little enough at the start that you don't flare it up. So my advice with that would be, first do a couple of weeks at least where you build your regular plyometrics up, that you know that they're nice and controlled, and then once you've got that volume good, then you can switch over to using the jump rope. But also with that, I would then do it as interval sessions, that you do 20 to 30 seconds of light skipping, rest for 2-3 minutes, and repeat that a few times. And then just increase those periods over time. Brilliant. So I hope that was useful. Short answer is yes. Jumping rope can increase your pain or cause pain if you've got if you're up it too quickly or don't recover well. Second is, depending on how your pain started, how long you've had it for, you may be okay with just rest and easing back into activities. But if it's been going on for a long time, you may need rehab. And then lastly, you can use it as part of your rehab, but you've got to introduce it at the right place and also at the right volume. Now remember, If you need any help with an Achilles injury, you're welcome to consult one of the team via video call. Link is in the description of this video, and let me know if you've got any questions. Take care.